Let's start with a simple question. How much is a human life worth? If you had to, could you put a price on it? Simple question, but not an easy answer. Now let's go a step further. Should that price be the same for everyone? Is the life of a child here in London worth more than a child in Mogadishu? I hope you're thinking, of course not. I know a few of you are probably thinking, where the heck is Mogadishu? It's in Somalia. Now, these questions may sound cynical, but in public health, we make judgments like this all the time. There's a tool called the cost-effectiveness threshold that helps policymakers decide how to allocate limited resources. It's a way of estimating how much we as a society are willing to pay to give one person a year of healthy life. Here in the UK, that figure's about £20,000. So if a medical treatment costs less than that to give a year of healthy life, the NHS will probably pay for it. How about in Somalia, one of the world's poorest countries? Well, by some estimates, it's about £200. Put another way, the life of a British child is worth 100 times more than the life of a Somali child. Feeling uncomfortable yet? I hope so, because this is an uncomfortable truth. There's a disconnect between what many of us believe and what we do. As a society, we value some lives more than others. And this notion is at the heart of much of what ails the world today. It allows us to avert our gaze when a woman dies in childbirth in a remote village. It's the reason that a fire in Grenfell Tower took 72 lives last year here in London. It's why thousands of migrant children seeking asylum in the US are sitting in cages today, separated from their parents. The good news is, it doesn't have to be this way. We can flip the script and insist that all lives do indeed have equal value. The technical term for this is equity. And here's the thing. When we make equity an organizing principle, it unlocks new possibilities and solutions. I've got proof, and it comes from an unlikely place, Rwanda. Now, it's impossible to tell the story of Rwanda without revisiting a dark chapter, the 1994 genocide against the Tutsi that took 1 million lives in just 100 days. That's a rate of killing faster than the Holocaust. It tore apart communities and plunged the entire region into chaos. Now, many people think that genocide was caused by ancient hatreds between two ethnic groups. In fact, it stemmed from colonial-era policies that pitted two groups against one another, creating inequalities that made it easier for the colonists to rule. And those inequalities and the resentments they fostered deepened during the decades after independence and then exploded in 1994. Now, most countries that experience violence at this scale never recover. The new government recognized this, but they also had an important insight: that desperate poverty and unequal treatment were among the underlying conditions that had made it possible to turn neighbors against one another. And so that meant, to prevent another tragedy, it was essential that nobody was left behind. And so, equity became something of a national security strategy. It became an organizing principle for the country. Equity was written into the new constitution as they began to rebuild. Now, meanwhile, something else was happening halfway around the world that would help Rwanda change its trajectory. A little organization in Haiti called Partners in Health started one of the first AIDS treatment programs for the poor. You see, back in the late 1990s, HIV was spreading unchecked across much of the globe. In some regions of sub-Saharan Africa, 1 in 3 young adults were infected. Entire generations were at risk of being wiped out. And this was just a few years after the discovery of new combinations of drugs that could keep HIV in check, turning a death sentence into a manageable illness. But those treatments were only available to those who could afford them. And that meant that millions of people were condemned to die simply because they were poor. To be fair, these drugs were expensive, $15,000 per year for one person. But that didn't make it right. Partners in Health was built on the simple idea that health is a human right and that all lives have equal value. And that's why they started off in one of the world's poorest communities. And that's why, when effective AIDS treatment became available in wealthy countries, the only appropriate response was to offer the very same treatment in rural Haiti. It wasn't easy. When they couldn't afford the drugs, they begged, borrowed, and occasionally stole them. There weren't enough doctors, so they deployed community health workers to accompany patients through their treatment. Now, it's important to understand how radical this was at the time. The conventional wisdom was that AIDS treatment was too expensive and way too difficult for poor countries. Instead, the experts advised handing out condoms and telling people not to have sex. Spoiler alert, it didn't work. But this was the zero-sum world of public health. We were told we had to choose between preventing HIV or treating those already afflicted. We had to choose between having facilities for safe childbirth or buying vaccines to keep those same babies healthy. We had to choose between malaria or cancer. But viewed through an equity lens, those are false choices. When we say it's not cost-effective, what we mean is that some people don't deserve the same things we deserve. Could you look the mother of a sick child in the eye and say that? Equity forces us to think differently. Rather than say no, we're forced to ask, how? If the drugs are too expensive to reach the people who need them most, the market must be broken. How do we fix it? If there aren't enough doctors, how do we empower community health workers to do the job? So you can start to see how using equity as an organizing principle can drive innovation. Partners in Health faced criticism at every turn. They were accused of being irresponsible, naive, of wasting resources. But they pressed on. And that little AIDS treatment program worked. Everybody got better. This program, and a few others like it, stood as a powerful challenge to the status quo. And coupled with a widespread movement of social activists, the world changed. By 2003, everyone suddenly seemed to agree that all people with HIV deserved a shot at treatment. And that unlocked billions of dollars in new capital and drove the price of drugs down to just $100 per year. Now, by 2004, Rwanda was one of those countries that stood to benefit from the new HIV funding. A decade on from the genocide, real progress had been made, but there was still a long way to go. Many families were still living in extreme poverty, and most lacked access to even basic health services. During the genocide, HIV had been weaponized through a campaign of rape, and the epidemic was rampant. The Rwandan government invited Partners in Health to come and help them introduce AIDS treatment in some of their hardest-to-reach communities. I had started working with PIH a few years earlier as a doctor in training, and they invited me to come along. I stayed for 12 years. We were sent to some of the most remote parts of the country. No roads, no electricity, no health facilities, no doctors, no Starbucks. You got that. We started in a place called Rinkwavu, a little village that had a hospital that had been abandoned for many years. So we took care directly to communities, house by house. Those who were sickest were put on treatment first, while those who were well enough to work were hired and trained as community health workers. Meanwhile, we started rebuilding the hospital as the patients poured in. For a while, we slept on the floor alongside our patients, and that's how it started. Within a few weeks, 100 patients were on treatment, then 1,000, then 5,000. Now, it's important to understand that HIV was just one of many ranking health problems. 1 in 4 children were dying before their 5th birthday. The problem was that there was funding for HIV, but not much else. I vividly recall attending a community meeting where a man stood up and said, "I'm very sick with diabetes, and every night I go to bed wishing I had HIV instead, because then you could help me." Again, equity was the mother of invention. You see, to treat a complex disease like HIV, you need more than the medicines. You need to have functioning clinics staffed with trained providers. You need clean water and electricity, pharmacies, and laboratories. So if you resist the easy temptation to treat one disease in a silo, you create a system that can provide for everyone. So as the HIV program grew, nobody else was turned away. Together with the government, we built intensive care units for premature babies, offered mental health services, even introduced cancer treatment. And together we invested in clean water and agriculture and education because those things affect health too. A few years later, the system was providing care for 1 million people and creating tens of thousands of jobs. And that was just one part of the story. Rwanda had set up partnerships with little experiments like this all over the country. And when a new solution showed promise, they'd quickly scale it up everywhere, starting with the most vulnerable. During the last 2 decades, life expectancy in Rwanda has doubled. Access to HIV care is universal, and outcomes for those patients are better than in the United States. Mortality among mothers and children is dropped by 80%. And with one of the world's fastest growing economies, well over 1 million people have pulled themselves up out of poverty. Rwanda has delivered the steepest gains in population health ever documented anywhere in the world at any time. It turns out that an equity agenda was not just morally sound, it was smart policy. Now, the funny thing was, when we started sharing these results, many of the experts were dismissive. It doesn't count, they'd say. Rwanda's a special case. It's small, it's organized, they have a unique leader. You could never do it anywhere else. But we believe that if Rwanda could succeed against such long odds, this could be done anywhere. And we realized that if we really wanted to change things, we would have to reimagine public health and train a new generation of leaders. Well, knowledge and education are the provenance of a university. So we started our own, and where better than in Rwanda? It's called the University of Global Health Equity. It's just a few years old, but we've already trained students and public health leaders from over 20 countries. Next year, we're opening a beautiful new campus on a hilltop. It's the beginning of something really special, and it comes just in time. You see, we're living in a moment of contradiction. Well, it's probably the best time in human history to be alive. There's real uncertainty about where we're headed. If we want to change our trajectory, we need to think differently. And that's exactly what happens when we make equity our North Star. It expands our moral imagination and unleashes the social entrepreneur in all of us. And then, like the people of Rwanda, maybe we can find the audacity to imagine a better future and then get to work creating it. It turns out, dignity and hope are cost-effective. Thank you.